Hello everyone, my name is Montserrat Raiman. The session or the lecture for today is about the maxillary and mandibular divisions of the trigeminal nerve. So the learning objectives for today are to describe and identify on diagrams, models and specimens the course and distribution of the three divisions of the trigeminal nerve and their major branches to include the structures each innervate. Describe the clinical assessment of the trigeminal nerve. Use your knowledge of the normal functional anatomy of the trigeminal nerve and other structures to explain common clinical problems associated with the nerve. Appreciate basic methods used to ease pain associated with the trigeminal nerve. Describe how practicing dentist identifies safe areas to place anesthetic in relief of pain associated with tooth extraction and other dental treatment, and is able to explain to the patient any reasons for paresthesia or anesthesia in regions other than the specific treatment area. And finally, apply your knowledge of functional anatomy and relate it to problems that involve the trigeminal nerve, structures it innervates, or facial pain. So you have seen this diagram of the pharyngeal arches before. So in green, we can see the first pharyngeal arch, which will give rise to the trigeminal nerve. And therefore, all the structures originating from the first pharyngeal arch will be innervated by this nerve. And you have also seen this table that summarizes the structures originated from each pharyngeal arch and which nerve belongs to each pharyngeal arch as well. This lecture is focused in the trigeminal nerve, hence I want you to observe the top of the table where the first pharyngeal arch is highlighted here in blue, and here we have the structures that are originated from this arch, and you can see that we have, for example, in terms of the muscles, the masseter, temporalis, lateral, medial pterygoid, so muscles of mastication. Also the anterior belly of the digastric, the mylohyoid, tensor tympani, and tensor belli palatini. And so this is the reason why the muscles of the mastication are innervated by the trigeminal nerve. And also why, for example, the anterior belly of the digastric is innervated by the trigeminal, but the posterior belly is innervated by the facial nerve. And this table has helped me to understand some exceptions. For example, the stylopharyngeus muscle here. This muscle is innervated by the glossopharyngeal nerve instead of the vagus nerve. Like we know that all the muscles of the pharynx are innervated by the vagus, with the exception of this one. And this is the reason why. As this is originated from the third pharyngeal arch. So I would recommend you to have a look at this table whenever is possible. Now, regarding to the trigeminal nerve, this nerve will exit from the anterolateral surface of the pons, so here, through the large root, which is sensory, and a smaller root, this one here, which is the motor one. And the motor root is located below the sensory root, and here at this level they are completely separated. In this picture, in the right side, we can see how the sensory and motor root are continuous or will continue from the posterior cranial fossa and get into the middle cranial fossa by passing over the medial tip of the petrous part of the temporal bone. So on the right side, we have the internal aspect of the temporal bone, and here we can see the petrous portion, and where the roots are taking the path to get into the middle cranial. So when the sensory root arrives to the middle cranial fossa, it expands into the trigeminal ganglion, and this ganglion contains the cell bodies for the sensory neurons in the trigeminal nerve. Remember that a nucleus is a collection of cell bodies in the central nervous system, whereas a ganglion is a collection of cell bodies but in the peripheral nervous system. So this ganglion is located in a depression known as the trigeminal depression on the anterior surface of the petrous part of the temporal bone, and is covered by dura mater in a dural cave. This is known as the trigeminal cave. From the anterior border of the trigeminal ganglion, then, we have three main divisions that will arrive from here. And from superior to inferior, these are the ophthalmic division of the trigeminal nerve, which is that one there. Then the maxillary division, which is this one, and then the mandibular division, this one here. So here we have the trigeminal nerve in the cavernous sinus. And in the left image, we can see these nerves from a lateral superior view. And on the right side, we have a coronal section of the cavernous sinus. Note how the nerves that are located in the lateral wall of the cavernous sinus are from superior to inferior, the oculomotor nerve, the trochlear, then the ophthalmic division, and the maxillary division of the trigeminal nerve. And medially, we will find the abducens nerve, that one there, and the internal carotid artery. So remember that the three branches of the trigeminal nerve carry sensory component for the skin in the face. So they need to exit the internal aspect of the skull, and they will need to travel through different foramina. So they can get to the skin. So the ophthalmic branch will go through the superior orbital fissure, then the maxillary nerve will pass through the foramen rotundum here, and the mandibular branch will go through the foramen ovale. And this is how the three branches will leave the middle cranial fossa then. Here we have again the trigeminal nerve exiting from the lateral aspect of the pons by a large sensory root and a small root in this top left image. The trigeminal nerve, as we know, is the main general sensory nerve for the face, as we can see in this image, and it also innervates the teeth, the mouth, the nasal cavity, dura mater of the cranial cavity, and the sensory root of the trigeminal nerve is composed mainly by central processes of neurons in the trigeminal ganglion. And in this image, we can see that the peripheral axons of the ganglionic neurons will then form three nerves or divisions. And these are the ones that we have mentioned before: the ophthalmic division in red, the maxillary division here in blue, and also contributes to the sensory component of the mandibular division here in green. So in this picture, we can see the dermatomes of the trigeminal nerve, and these are zones of skin innervations of each division of the trigeminal nerve. So the superior portion, the forehead, the eyelid, and also the nose are innervated by the ophthalmic division. Then the middle portion, consisting of the cheeks, the inferior eyelids, the alar portion of the nose, and also the upper lip, are innervated by the maxillary division, and the inferior portion, including the lower lip, the chin, and this lateral surface is the region innervated by the mandibular division. But note that the angle of the mandible is not innervated by the trigeminal nerve, but is innervated by branches of the cervical plexus, and this is very important because you will need to know this for your clinical practice. Right, and how do these nerves reach different areas of the face? They will again exit through different foramina. So the ophthalmic division exits as one of its branches, which is the supraorbital nerve, through this supraorbital foramen, this one here, or in this case a notch, supraorbital notch. The maxillary division exits as the infraorbital nerve through the infraorbital foramen, and the mandibular division will exit as one of its terminal branches, the mental nerve, through the mental foramen, this one here. And if you draw a vertical line, this wall will pass through the three foramina.